Good afternoon, everyone, and welcome to today's webinar, the fourth in our four-part series for Mental Health Awareness Week. Today's webinar is entitled Mental Health Literacy, Self-Care, and Equity. My name is James Campbell, and I'm the Senior Manager of Industry Relations with NAA. I want to welcome all our members attending. Thank you for joining us. Let us begin by sharing this word from our sponsor, MRI Software.
MRI Software is proud to support NAA and Mental Health Awareness Week. Mental health is something that impacts all of us, especially property managers. While these fearless frontline employees are experts when it comes to taking care of residents and their businesses, the demands of the job rarely allow time for them to take care of themselves, and it's taking a toll. In fact, our latest Voice of the Property Manager, in partnership with NAA, revealed that 74% of property managers say their job negatively impacts their mental health. We can do better. Everyone has a right to feel safe, happy, and healthy in their work environments, including property managers. At MRI Software, we believe in building thriving, well-connected communities. People, and more specifically property managers, are the heartbeat of those communities. And we're committed to having critical conversations, helping elevate their voices, and investing in real solutions to make their lives better.
Before we get started with our presentation, I want to go over a few housekeeping points. First, this presentation is being recorded and will be posted to our website and YouTube channel next week. You may then share this presentation with those colleagues and friends who are unable to attend at present. Second, we have allotted time at the end of today's presentation for live questions and answers. But you may also type your questions into the Q&A or chat boxes on your screen at any time during our presentation. With that, let me turn things over to our host, Stephanie Anderson. Stephanie?
Thank you, James, and welcome to everyone, all of our attendees today. My name is Stephanie Anderson. I'm the Senior Director of Communications and Social Media for Grace Hill. I am also a member of NAA's Mental Health Subcommittee. And of course, the topic of mental health is truly important to me and my family as well. So I feel honored and privileged to be able to be a part of today's presentation. With that, it is really my great pleasure to introduce today's presenter. Tremaine Elamine is the National Council for Mental Wellbeing's Vice President of Mental Health First Aid USA. She brings over 20 years of experience in mental health equity, advocacy, cultural and linguistic resonance, DE&I, social impact, and leadership. Prior to this, Tremaine led initiatives on community engagement and changes related to the Affordable Care Act. She also has published research in public mental health education and systems transformation. Wow, that is incredible. And that's only a small portion of what Tremaine has done. So without further ado, Tremaine, the virtual stage is all yours.
Good afternoon. Thank you so much, Stephanie. Thank you so much to NAA, and great to be here with you. I am elated to talk to folks who I've been talking to for my entire life. And now I know that that might sound a little bit like a stretch, but I truthfully grew up in apartments world. I grew up as the child of a property manager, the child of a owner operator of an apartment building. And so definitely an opportunity to have a full circle moment that my work in mental health is bringing me back to this space and having an opportunity to talk with you today. So first of all, thank you so much for joining, for tuning in. If you want to let us know in the chat where you are, that would be amazing for those who are joining us live. And for those who are going to be viewing this later, you are part of the conversation too. I'm hoping today can be a dialogue, that this is not just me as a talking head giving you information and you're just absorbing it, but I want you to really have the opportunity to pause, to think, to take the time to have this time for you. We're talking about today self-care and equity. And what does that really mean for you? What does that really mean for your workplaces, for your communities? What does that really mean for what you want to do as it relates to how you transform your well-being programs, your workplaces into places that are safe spaces to have these conversations. And those conversations don't have to be scary. So as I think about that, as I think about who I am, how I show up today, what's going on for me, I would like you to answer a question for me. What is it that you represent? Who is it that you represent? And what is one of those most important factors for others to know about you? I gave you some information about myself. I am a Philly girl through and through. Go Birds. No offense to anyone else. Those are things that I know that I share. There's things that I present that I might not share verbally that people can see and make assumptions about me. So if we think about what's important to us, how we communicate that to others, and how do we take care of ourselves in the face of all of those identities, that is what we're going to talk about today. And as we think about the end of this wonderful series, the end of this wonderful mental health month, and an opportunity for us to share together today. So keep that thought in mind. And if you want to, go ahead and put into the chat or to the Q&A a little bit more about answering that question. If you want to tell us a few things and we can see who's responding in that Q&A, what are some of those things that are important to know about you? Definitely in the Q&A. We've got Portland, Oregon represented. Go Blazers, I hear that. We've got folks from all over in the Q&A box that we're seeing. And so thank you so much for that. I think that there's such an opportunity also as we think about all the identities that are represented across NAA's ecosystem, if you will. We think about how you show up to work, how you show up in the workplace, in the workspace, whether you're in Georgia or El Paso, you are showing up as one of these identities that might be represented at work here, right? As a resident, for some of us who live in multi-family dwellings, as a supplier, perhaps in Virginia, as places, an executive, as folks who are connecting the dots for ourselves and for our workplaces. But also, I think that residential staff that are in the spaces and in the places, property managers that are sharing space with our residents. I think that that's another space and a part of our identities that makes us unique, right? And I think that that's one of the things that mental health and well-being help us do is show up fully as ourselves, to show up in ways that allow us to really embrace all of who we are. And I think that one of the things that is important to understand is that culture is complex, right? I think one of the things that we also recognize is that our values, our norms, our expectations, our identities, it all affects how we see the world, how we live our lives, how we connect with others, and even how we organize our home and our communities. I will tell you that I am way better an organizer in my workspace than I am in my other living spaces. I will tell you that there's parts of me that I share with all of the world, and then there's parts that maybe just my family gets to see, right? I think that that's who we are as we are coming into our workplaces. And so as we think about mental health and well-being, there's a couple of conversations that we're going to have today. I think it's important for us to have a real clear understanding of where we are going in order to get to a shared destination. And so we're going to explore some of those unique experiences about our identities, especially those of us who might be from historically marginalized communities and how that relates to our well-being. We're going to talk about common terms and language that we might want to use or try to use as it relates to changing how we have this conversation in the workplace. And then we're also going to talk about how did we get here? What are those systemic or systems changes that have happened over time that caused some of the disconnect between how we show up in ways for those that are sometimes our nation's most vulnerable? And then if we think about how communities and workplaces have really showed up and began to step up and enter into some supports and identify those resources necessary to just push well-being ahead. That is another place that we'll have our conversation centering around today. Now, I told you where I am in terms of who I am. I haven't told you exactly what I do. And I typically don't start conversations about what I do. I talk about who I am first, and then we can talk about what I do. And I have like one of the best jobs in the world, just saying, because I get to share information, data, help communities, organizations and workplaces figure out how do we have these conversations in ways that really resonate with people and don't make it so imposing and scary. And so one place that helps to have these conversations and to make sure that we can start in a place of shared understanding is with data. And so if we think about where we're going and what we already know, that's what we're going to be grounded in today. What do we already know, especially as it relates to our mental health and well-being? As you see on the screen, 1 in 5. We've heard that throughout Mental Health Month. We know that 1 in 5 of us in any year, any given year, can meet the criteria for a mental health challenge. And there's even almost a 10% of us might be experiencing a substance use disorder specifically. And for our workplaces, that's tremendously impactful when we think about many of us work with more than 5 people. And so we want to be sensitive to that within our workplaces. We also know that the impacts go beyond performance and engagement, but they also hit those bottom lines in terms of productivity loss, which can top $1 trillion globally. And it's also those work days that might be lost specific to mental health challenges. I think that's what we do know, and that's important for us to know. But I think it's also about what we know about the impacts of historically marginalized communities, specifically from a community that is part of my own identity. Almost 5 million people who identify as Black or African American report having a mental health challenge, but there's a disproportionate amount of those individuals who do not go on to get care or who are caregivers for others, and it's really impacted disproportionately by things like COVID-19, things like employment or unemployment. It's also, while individuals who might be from marginalized communities might experience distress, they're 50% less likely to actually go and get treatment or services. And if we think about multiple intersectional identities, like those that might be part of the communities represented within LGBTQA+, that is really important to understand that young people, as well as adults, really have a higher risk of suicide in those communities. And so I think it's important that while we know these things, we also know that there's hope. We also know that there is a way to think about our current landscape. It's not just about what's from the neck up, right? We think about mental health holistically. It is a mind-body connection. We know that there is a connection, for instance, between recent years, we've been showing more and more understanding of the mind-body connection through functional MRIs, through the latest in technology that's helping us understand the connection. It's not just about mood. It's not just about something you can snap out of. And I think it's really becoming clearer to folks that how we manage stressful situations with support, without support, we may be impacted in our sleep, how productive we are. And then there's also an epidemic of loneliness across the US. And that's, especially in this industry, I'm sure that it's seen quite often. And in the worst case scenarios, that could lead to self-harm and suicide. And so that's why it's important for us to have this conversation. The other thing that we know about our current landscape is that poor mental health, it's going to show up in a number of different ways. It could be everything from having a challenging day, or having mild anxiety or depression, or severe addiction or disorders. And so it's important for us that the impact, to understand that that impact is always hard. It is always challenging, and that there's a lot of risk factors that go into someone experiencing challenges around mental well-being. And the things that we might see and might judge as very simple tasks somehow become insurmountable. And so that's important for us to think about that impact to the day-to-day life as we think about our workplaces. A lot of times I think back to some of the judgments I've made, and don't look at me like that. Don't look at me like that, because I know you've made those judgments too. When someone, shares in the workplace that they're having a tough time and then explains what it's about, sometimes we get judgmental. Sometimes we take a moment and we might say things like, oh, it's not that bad, right? Oh, it'll be all right tomorrow. And some of those statements might not be as helpful. So we have to think about how stigma is created. Sometimes it's these well-meaning statements that create the stigma that let a person know it's not a safe space to actually share what's really going on with them. And if we think about wellness and how it involves the body, the impacts over the last couple of years, the impacts that marginalized communities might even think about as it relates to injustice and current events within our world, those take a toll. And so having challenges is not new. Having a mental health challenge is not new. It is something that's been exacerbated over the last few years, especially with so much going on in our environments. But what's also not new is the help and the hope that is available. And so as we think about that, I want to transition our conversation to talk a little bit about self-care. And so who are we? What are we talking about? And where am I coming from? Before I get to that, I think it's important to answer that question of who are we? And I have the pleasure of serving as one of what I call a team of Avengers. We are an organization that supports the nation's most vulnerable by being an association, much like NAA, that supports more than 3,500 organizations across the country that are providing mental health services in the community for folks who might have no insurance or very limited insurance, and folks who are among the nation's most vulnerable people. And when I say that, I mean the 10 million adults, children, and youth that are maybe receiving Medicaid services, maybe in communities where they're getting free care in order to support their well-being. And to do so holistically for substance use and for mental health challenges. And so while we have been around for 50 years, for the last more than 12 years in the US, we've been running a program called Mental Health First Aid. And I have the pleasure of leading that team, have been here for 10 years and seen the growth from 70,000 people. We just celebrated 3 million individuals across the country being trained to recognize those warning signs. And so I think that it's really important to understand that context, because as we think about self-care, self-care is one component of mental health first aid. And I don't know how many of you all have taken CPR and first aid. You can raise your hand even though I can't see you. But if you've taken CPR and first aid, you learned a mnemonic. You learned a set of letters to help you remember what to do. And mental health first aid does that. It's just like CPR. It teaches us how to recognize those warning signs, whether at work or at home, and get someone connected to any one of the services that might be in our community or within our own workplaces. It's not teaching you to be a therapist. It's not teaching you to step into situations that you might not be prepared for. It's teaching you what to look for, how to recognize it, and how to connect the dots to help. And so I think that that's important because it really intersects really well with how we think about where is this disproportionate impact happening. If we think about those individuals that I talked about, the more than 10 million that our organizations that we represent in policy and advocacy and in training and education, those individuals, how is that showing up for them on a day-to-day basis? And what exactly do you mean by health inequity, Tremaine? I think that it's important for us to think about what it is and what it is not and where it came from really quickly. We think about it's the distribution of access and opportunity, and how is that showing up for people or not? It's talking about what's the outcome? What are the experience differences? And it talks about that from all of these domains that we see: our values, our abilities, our strengths, all those identities that we talked about earlier. They really do impact how someone receives health services in the country. It impacts how someone might experience access to treatment or services, as well as it's what's preventable. How do we decrease these inequities by figuring out where those adverse differences are in health, where are they experienced by marginalized populations, and how do we make sure that we think about the more advantaged populations getting those services, and where are those inequities, and identifying them is important. But there's always opportunity to think about how do we make sure resources are available in equitable ways. And so that's one of our areas of focus. And if we think about health inequities, then it had to come from somewhere. How do we get here with these health inequities? If we think about that, one of the ways that we've gotten there is three components, actually, three ways: access, medical mistrust, and misdiagnosis. Those are three ways that they have contributed. There's many more. If we think about our global society and how wealth is distributed, how access is happening, that is happening in ways that really sometimes can disconnect someone from those resources based on their socioeconomic status, based on their access to information, literacy. There's so many components that can go into access, but sometimes it's about historical harms that might have been done. And sometimes for marginalized communities specifically, it is important to understand that diagnosis and information and relationships with the healthcare industry overall might have come from somewhere, whether that's studies historically that were done without the proper protocols, or language differences, how symptoms are talked about from a cultural perspective and lens, and how much training healthcare providers might have as it relates to mental health or physical health, for that matter, in doing so in ways that are culturally congruent with the group that might be presenting. So if we think about those two backdrops, it really is an opportunity for us to also think about where did this come from as it relates to how effective treatment is. People may not be accessing services because they just fundamentally in their own culture may not believe that those are the appropriate ways and resources for them to get the help that they need. And a lot of times historically, we've separated things that work for folks that might be culturally congruent for their own experiences and said, well, this is the best way to do it. And that is not necessarily evidence-based. And so one of the things that we make sure we talk about is that there's things that are evidence-based practices that we study that are traditionally Western ways to operate. And then there's things like practice-based evidence, where we know things and practices that are culturally congruent for folks have happened over time and really work to help them kind of engage in the services and supports that might be available. So how does this show up at work? Well, it could be that these have to do with how satisfied someone might be with their services, how much they feel like having these conversations is helpful to them. And sometimes it's about what's going on in their social network. But then it's also this other side of our cultural experiences and the experiences of our identities, where we can think about how it might not be harmful to have some distance between one set of practices that might work for someone else and things that might work for ourselves based on our cultural experiences, because that they've pointed to historically survival and resilience. And so there's all kinds of ways that we can think about our social networks, how we get care, whether it's just treatment in this traditional sense of the word, or are there ways that we can heal in a community setting? Are there ways that we can think about collective ways that have resonated for our specific cultures to really support well-being? I give you this backdrop as just information to help you understand that the way we got here is really influenced by so many factors, but the way we move forward is together. And we can do that by making sure that we have information and education on what it really means to take care of ourselves. And sometimes that looks different depending on our experiences and our identities. So what's the difference between getting care and having self-help and then having self-care. Let's talk a little bit about the differences between those things. A lot of the information I just shared was about the traditional treatment models in America. We go to therapy, which is great. I advocate for that. And I definitely think it's necessary in certain circumstances. But that's for the 1 in 5 of us that might need to make sure that we are engaged, or the 1 in 5 of us every year who might be going through something that we really need additional support to navigate. And then there's the other percentage of the time where we might be looking to help ourselves in some way. And self-help is that focus on our efforts to get healthier, to do better. Some of us might have, for instance, some goals at the beginning of the year that we're attempting to meet. Some of us may have fallen off of those goals in February. Hey, no judgment in this space, no worries. I've fallen off on those too. But if we think about how we approach those things, it's typically around self-help. And if we think about that, our focus is really about how do we support ourselves, and it's how do we take our own energies to support ourselves in getting better. And that's something that is really important. But today's focus primarily is about self-care. And so if we think about our focus on how we take care of ourselves and recharge after challenges or just a day that we've had, it's about how do we manage our stress? How do we create spaces where we can create new behaviors and not just the bubble baths and the shopping sprees and the travel that sometimes we hear talked about online? I think self-care is something that has become more of a term that everyone is using. But if we think about how it shows up for us in a day-to-day basis, it really is about what is going to be effective for us, right? It's not just about the external. It's about those new behaviors that we can adopt in our day-to-day routine that help us take time away and remind us about why that's important. A lot of times I think about this concept of balance, work-life balance, right? And how often we are out of balance, right? It's a moment-to-moment opportunity for us to think about where are the ways in which we can create space for ourselves in the day to actually focus on this. And sometimes it's going to be 30 seconds. Sometimes it's going to be 5 minutes. Sometimes you can actually take an hour, but sometimes that might be rare. And I think that this focus is really important because if we think about our organizations, a lot of times we think about it through the lens of the work that must be done. And we think of self-care about how can I fit this in my already full plate. But we also have an opportunity to think about, as organizations and as leaders within organizations, how are we creating those spaces to give these reminders to folks? And structurally, what are we doing to make that available within those places? And so it really is an emphasis on that stress management. It is about monitoring our own levels, and it is driven by a mindset that helps us think about this as essential, not an add-on. But what are those practices, those concrete things that we can do? So it's not just about things I should do, or I should get this habit, right? But it's really about an everyday experience about who we are. And so I think that that's always the challenge, finding the ways in which we can make that real and a reality for ourselves, especially for us who might have additional factors that factor into our day that are connected to our identities. And some of those factors can be kind of balanced by thinking about what are those benefits to actually, what's the outcome? Not what am I going to do, but what's the outcome of me actually taking this time? So you've heard me say self-care a couple times. You heard me say self-help a couple times. Go ahead and put into the Q&A box a few opportunities that you've taken lately that, if you look at this list, what was the reason you might have done some self-care? Look at the list that's here, whether it's improving your own well-being, if it's making sure that you're extending your life, making sure that you are having more immunity inside of your body. We know that that happens, lower risk of heart disease and inflammation as well as stress management. But think about those things that you've done, and you can either type them in the Q&A box or think about them and just reflect on them for yourself. Are you connecting your behavior to what the benefit is, right? A lot of times we tend to talk about these things as self-care, and it's kind of woo-woo, as people have put it. It really is about what is that benefit analysis, just as we would do as we think about our workplaces. What's the bottom line? The bottom line is our health and our ability to show up every day is directly connected to our mental well-being. And so if we think about self-care, it really is, how do we enrich the work that we do by making sure the vessel that we do it from is well taken care of. And so if we think about that, I think it's important to also focus on, and thank you so much for those who have put those opportunities in there. I think stress management is like number one. If I would have done a poll for this one, I think folks think about stress management. We see that coming in a lot now. Is one of those number one reasons folks kind of lean on self-care. But I have an invitation for you today, which is to reframe that for yourselves. Maybe, just maybe, it's not just about the self-care for the opportunity to decrease stress, but maybe you can reframe and look at it. What's the benefit I get out of taking this 5 minutes to do this activity, and connecting it to your physical health, because that is what that brain and body connection really is about. You know, I think that a lot of times we also conflate the benefits of self-care with self-indulgence, right? Or something that people get to do in terms of from a class perspective, or buying myself things, or some kind of other physical and monetary value. But it really is about making sure you're in tune. You can do the indulgences, by all means, do those. But also, what is it that you will need to make your brain function optimally? And so you're not going to ignore the gas light that's in your car for too long, right? You're going to pull over and you're going to get gas. And so you shouldn't ignore the cues in your body either. It's really about making sure that, and research has demonstrated this, making sure that you are looking at what those positive outcomes are, just for looking after yourself, just for taking the time. And like I said, it's easy as just taking 5 minutes consistently. And so let's go on to talk a little bit more about what's at the core of this. It is really about protecting your own well-being, especially during times of stress. It's also balancing and knowing your limits. So it's not just about the yeses. What am I saying yes to? It's also about the no's, right? It's really about making sure that you are taking moments, even now, to maybe deep breathe a little bit, maybe ground yourself a little bit. And it's also about something else that has a self in front of it, which is self-compassion, right? It's treating yourself with kindness and care and support and empathy. And I think that a lot of times, depending culturally, right, whether that's, how we show up in the world, this is not a conversation that's a typical conversation. We don't do the introspection and kind of focus on ourselves as much because it's about doing for others. And we'll get to that. That's a good part and component of self-care. But it is really about making sure that this self-compassion, this talking to oneself as if you're talking to someone you care about is really helpful. And so these days, the idea is more broad and includes a lot of self-oriented acts, but it really is about how you manage yourself and identifying those things that are helpful for you and taking those actions. And especially in an environment where you're dealing with stressors that are not only the stressors of day-to-day life, but maybe environmental stressors based on your own identities and how you show up at work, how you show up in the world. There's an added burden there. So making sure you're paying attention to that by finding those opportunities to connect the dots to support. And so let's talk about some of those strategies. And as I put some of these up, feel free to put in the Q&A box if you have questions before we go into these details. Feel free to put those questions. That'll be great. I know that in this environment, the Q&A box is the medium for this. So feel free to put that in here. We've got some great comments from folks about, making sure you're connecting the dots between that physical and that mental health. And so we're going to talk about that in a moment. But also want to make sure that folks know that they can ask questions as we go in the Q&A box. So let's dig in. Let's dig into a few more strategies for individuals and organizations. And I think that this is important for a number of reasons. I think that there are so many things that we think about when it comes to self-care strategies as an individual, right? And we'll talk about those, but I also think that organizationally, a lot of times we don't set folks up for success, especially in the industry that we are in, because there's just not the time. But it can be done, and hear me out, it can be done because there's some structural barriers to that, right? Deadlines and consistent challenges with workforce, and making sure that all of the pieces are in the puzzle, whether that comes to resident challenges or even in the corporate environment, just finding the time for these things. Perhaps it's in the team meeting. That's the 5 minutes that's spent, right? And like I said, it's all about just finding those 5 minutes. Maybe it's there in the team meeting and little reminders that you can have. Maybe it's creating a space to end a meeting earlier and then encourage folks to go and to attend to their self-care in some way. I think that there's all kinds of ways that we can encourage this from a systematic perspective, and then thinking even more deeply about not the day-to-day, but our policies, our procedures. How are they really supporting people's well-being and our employees' well-being within the workplace, and finding ways to do so that may not be a large ticket item that needs to be purchased. It may not be things that we can do that are changing the full structure of how we are oriented, but there are ways that we can find to support well-being. And we'll talk about some of those a little bit later. When we think about individual self-care strategies, it is about the yeses and the nos, right? The things that we want to set boundaries about. I talked a little bit about that. It's also about taking the brakes off. I think a little bit back to a few years ago when, I had a family member who was experiencing some challenges, and I was able to be supportive to that person, but did not take the moment for myself. I had to go and actually call and get support from my EAP services at work in order to figure out how to navigate that balance toward myself. And that had everything to do with who I showed up from a cultural perspective as, right? As a cultural, from my own experience, you don't talk about these things. You don't deal with it. You just do, and you keep it moving. And so knowing when you need those breaks, knowing when to take those breaks is important. All kinds of breaks. Put the brake on, as it says on the screen, but also breaks throughout the day. I think also it speaks to time off and using that, or connecting where you can, making sure that you think about your skill set and your values, and looking at those day-to-day ways that you can connect to those in real tangible ways and growing those. But also it's the simple solitude, sometimes the silence, as well as opportunities for reflection. I love this last one, being still and move. And so we think about moving and movement. We're not talking about have a dance party, but feel free to do that if you want to at your desk by yourself. But it really is about the science behind physical movement and how that is something that's inherent in us. It is primal and necessary for our bodies to work. And it's also about the neurotransmitters that exist within our bodies. And so definitely an opportunity there. I think also if we think about, again, self-care, finding someone who's way better at this than you are, right? And finding some accountability for that, to incorporate it somewhere in your week, somewhere in your day, can be an opportunity as well. And then there, like I said, there is an opportunity, especially as for individuals from marginalized communities specifically, to think about what does this look like for you in the context of your own culture or any cultural identity. What does that look like for you to really show up and have self-care? I love some of the things that we're seeing come into the chat. Consistent walks at the end of the day, short meditations, that's great. Love those. Journaling, that's another one that's awesome. I think that that's wonderful. And I think that we also had a question come in that I want to make sure we cover, which is, what's a way to present a request for a day off from work? If you're doing something very busy in the season or the week, how much information do we want to make sure we either say or don't say? And I think that that's really a great segue into what we think about as we think about our organizations and some opportunities for us to have that conversation. So I'm going to come back to that. I love that question in a moment. But that ways in which we have the conversation at work has to do with how we support our employees. And it has to do with how we really recognize these protective factors and some of the risk factors that might exist. I think I like to focus on the protective factors. We know risk factors exist with either previous history of mental health challenges, our environment and stress, a predisposition based on genetic factors. It could be so many things that cause risk. What I found interesting is I saw a study done in the apartment industry as a whole. And one of those protective factors that not only the individual protective factors that you see on your screen across these 5 domains of biological, social, cultural, psychological, and familial, all of those exist at the individual level. But there's also protective factors as an industry, which I thought was very just interesting to me, which was this sense of community that you all have from a staff perspective and as an industry, that connecting to others. I told you earlier that there's this epidemic of loneliness across the country. There is just increased risk for suicide and suicidal ideation. And that connecting and that disconnect that happened as a result of some of what happened over the COVID-19 pandemic, as a result of just the isolated nature of the work sometimes. I think that some of our opportunity is to lean into that as an industry, to that protection of connection to others. I saw that represented at NAA at the meeting. I see it represented in the apartment communities that I've been a part of. And so leaning into those connections to others as a protective factor, in addition to doing things at the individual level, like nutrition, like exercise, making sure that we have belonging to our cultural experiences and celebrating those, and then acknowledging when those are impacted by external events. I think that's another way to do that in a systematic way across an organization, is to make sure that we're checking in, we're making sure that we're connecting. And I'm kind of giving away the answers here to the next question I had to you. So keep that in mind as we talk a little bit more moving forward. The bottom line that I'm hoping that you hear is that self-care is not an individual sport. It doesn't have to be. Yes, it can be, but it doesn't have to be an individual sport. Community opportunity, community response is something that we've seen be in the literature and the research, as well as in personal experience, be completely helpful in making sure that there's opportunity to connect what I'm doing for myself to what I'm doing for my community, to what my community can do for me. And a lot of folks have the 2 parts of that down, of what I just said, right? What I can do for myself, they might do a few things for themselves. What I can do for others, they might have some of that going on in their experience. That last part, what my community can do for me. We have to learn how to receive support. We have to learn how to have these conversations, and that's what we do with Mental Health First Aid, and I'll talk about that. But we need to learn how to receive support, and that's really critically important. I think also culturally based practices, acknowledging them, celebrating them, recognizing that how someone heals might look different based on where they're coming from is important. And then allowing a person to be self-directed in how they navigate care, and then letting them know what those resources are to do so. So as we move forward, I think it's also important to think about what it is how it is that we move forward. And we've created at National Council, we have taken mental health first aid and created this graphic that helps us remember the process, remember what algae is. And it sounds like pond scum. I guarantee you it's not. It's just like those ABCs of CPR or CBA, depending on when you took first aid. It is an opportunity for us to learn, how do we support others? How do we support ourselves as we support others, and how do we keep everybody safe and learn what those resources are in our communities in order to provide that support? And so if we click it 2 more times, something really cool happens. Maybe a third. It moves, right? And the reason why I love that part, it's like literally my favorite slide. The reason why I love that part is because it's not just about how we approach someone, which it is. It's not just how we listen and non-judgmentally, and we get into that and how that's really hard to do. We talk about giving reassurance and information, not saying that everything's going to be okay, but saying that I can imagine how hard that is for you. Definitely help is available. We encourage help, right? Professional help, if necessary, or we teach folks how to navigate. Is it self-help that would be really appropriate here, or is it some other kind of help? Or is it an emergency and a crisis situation and we need to go get help from others in order to support someone? All the while, that assessment that's done in the middle is just about making sure that we're staying aware, not a clinical assessment. We don't teach people how to do care and treatment. We teach people how to connect the dots. And so one of the things that I also love about this and that movement is that it's really about the cultural context you're in, whether that's your cultural context in your workplace. That's a cultural piece of what's going on for you. It might be other kinds of identities that one might represent, but it's also about the workplace resources that might be available, or might be available nationally, or even from NAA as they begin to roll out additional resources to this community. And it really is held in the context. We don't do algae by itself. We don't do mental health first aid by itself. It's always within the context of our own cultures and experiences, as well as within the needs and resources of your workplaces and in your roles. And so as we think about the next piece of this, someone asked earlier, okay, well, how do I have this conversation internally? What do I do? Where do I start in order to have this conversation? It really is about what you're noticing that might be a factor. And so some of those kind of early signs that we want to look out for, not only as we practice our own self-care, right? Because we practice that process, that algae action plan in the context of taking care of ourselves and making sure that we don't step outside of our own comfort, that we make sure that we're comfortable having the conversation, that we know and check in with ourselves about where we are. We might be experiencing grief and loss. We might be experiencing some other kind of impact to ourselves. So we need to be aware of that. But as we're aware, we might notice for someone else a pattern, or a pattern in ourselves. Are we taking a day every time we get a day? Right, in terms of absenteeism? Are we missing in action, not necessarily checking in as we typically did? Are we demonstrating or seeing someone else demonstrate statements that sound hopeless, right? I can't do this anymore, or some other statement that points to they might be at risk for suicide? Are we looking at things like anger and rage and seeing that show up in ways that weren't there before and aren't typical for the person that we're engaging with? Is it that we are, noticing that their responses are out of character from what they were typically engaging? Or you're seeing decisions not be made in the ways in which they were being made before? I say in the ways in which they were being made before a few times to underscore the importance of understanding that this might look like a pattern if you currently engage with someone on a regular basis, but it also might look like a pattern, for instance, if you're in residential spaces and engaging with residents and you're seeing these patterns change over time. And we can even practice this even if we just have met someone for the first time and are engaging with them, and we might hear something that allows us to ask more questions. And that's fundamentally what mental health first aid is about. How do we ask more questions? How do we not pry, but make sure we have balance in respecting the boundaries of a person, respecting their individuality, respecting their experiences, but also making sure that we respect their privacy, right? And so we teach how to do that. And we'll talk about that a little bit more. As we think about that additional support that we're providing within the workplace, one of the ways that we think about self-care is, yes, taking days or time away and creating that in a systemic way, in a way that's across your systems, across your departments, across your organization. It looks different in every organization. And so the way to navigate that is based on the context of where you sit in the organization, what role you play. Are you a supervisor or manager, or some of the considerations you want to take in? You also want to think about the fact that everybody processes stress differently. And when you're encouraging employees to reach out for support, that you have those resources available, that it's not just saying, are you going to do this or call this number, but maybe following up, especially if you're in a position of leadership, there's an opportunity to do that. Or if you're a peer, that's an opportunity to do that. I think also it is imperative to partner with your human resources community. If you are an HR professional, to get training and education to help people navigate these conversations so that you are not only supporting the needs of the organization, but also supporting others in ways that are within the confines of your policies and procedures in your organization. I think that it's important for us to remember that just because someone was great before doesn't mean they're great now. They said they were fine before doesn't mean you're fine now. And we practice in mental health first aid kind of having those conversations. And you can do that too, external to taking the course. You can practice having this conversation. Go over the dialogue before you actually talk to a person. Making sure you're thinking through, what are those resources? Do you have EAP services available? Are there free resources online? Are there apps that are vetted, that you trust, that can be helpful to this person? And then also thinking about, where are there natural opportunities to make suggestions about things like mental health days? Is there a committee or a employee resource group, for instance, that could kind of raise that as an opportunity? And you can do that while protecting the anonymity of a person, unless you hear something that is so distressing that a person might be in crisis. And in that case, you want to reach out for help. You want to call 988, which is the Suicide Prevention Lifeline, and follow your organizational procedures to notify whomever needs to know if you see that someone might be in danger. You also want to ask questions. Ask a person what they might need. Maybe asking them what worked for them in the past to deal with a certain circumstance. You also have an opportunity to think about, what is the time and space someone needs to grieve, to come back later to support someone, and then also checking in on a regular basis and making this conversation, bottom line, a part of the everyday occurrence in the organization, so it doesn't feel kind of like an extra burden, or a person doesn't feel like they're being a burden by experiencing a challenge within within themselves or within their lives. Because we show up as whole individuals at the job site, we show up as whole individuals within our communities, and all those identities that we might represent might be being impacted in different ways. So asking and checking in and allowing a person to be their full selves and to share with you, it creates that psychological safety that's necessary. So there's a number of resources that are specific to how someone might look for, where do I start? Where do I start having this conversation? And especially as I think about equity as a part of that self-care, a lot of times having resources that resonate is really important. And so I've listed a few of them here, and we can provide them afterward as well. The NAA website will have some of those resources, especially they're going to be talked about in a moment. Then there's Mental Health America has some culturally based practices. There's some information about different communities and their experiences, and really evidence-informed information that I think is really well vetted and well received. NAMI also has some identity and cultural dimensions content specific to LGBTQ+ communities, as well as I've listed those that are for a number of other communities. that have an opportunity to tailor the information to really resonate from a cultural perspective. And there's all kinds of other resources out there as well. National Council, thenationalcouncil.org is a resource, as well as mhfa.org to also get additional information. So I have one thing to leave with you, which is I want you to think about you. I want to bring it back to that self-care. I want to bring it back to your next 24 hours. Because a lot of times we go to these webinars, we go to these spaces, and we hear information and we say, okay, that was cool. And we move on with our day. We move on with our lives. And we don't take the time to think about what's that one piece that I can practically apply, let's say in the next hour. I'm going to challenge you. It says 24, but what can you do in the next 60 minutes to attend to your well-being? Go ahead and put some of those in the Q&A. Please do put some of those in the Q&A. What could you do in the next 60 minutes? I know it says a day, but we're not giving you that much time. We're going to give you the next hour. What's something you can do? And if not the next hour, it might be a long weekend for you. It might not. But what's something you can do for yourself? Someone said actually logging out for my break. I love it. Take a walk, get up and move around. I love it. I love it. Yes, we can. What about just breathing? Doing something very specific for yourself. It's important because it's about your physical well-being, which means that you can show up as your full self at work as well. Gives you that opportunity. So I am so grateful for your time today. I'm so grateful for your attention today. And if you're viewing this later, I'm so happy to answer questions. You can email us or you can ask them now. Looking forward to having that opportunity to open it up for additional questions. And thank you.
Tremaine, that was amazing, amazing. And to end with such a powerful question that really allows our attendees to look within themselves and to truly think about how they can make an impact. I absolutely love it. My mind is moving quite a bit over here thinking about myself, and what a great lead in as we start thinking about tomorrow's day of action. So not only are you going to do something in the next hour here, but we're also going to encourage you to utilize tomorrow. And you know what I noticed in the Q&A box was that we actually had someone who commented. Kendra said, my company did a day of action tomorrow, so we're off. She's going to take time with her dogs, go on a hike around the lake. I absolutely love that. So now that Tremaine has given this amazing presentation, we do want to invite you to ask any questions. Now, she's answered some of them already, which is fantastic, but we want to give you one last chance to ask the expert while she's here. So go ahead, use that Q&A box for me. Type in any questions that you have for Tremaine. We just have a couple of minutes left in today's webinar. So if we're not able to get to the questions today, I assure you we will follow up after today's webinar. We'll give you just a moment to type those in. Tremaine, your bright blazer gets me happy, to be inside and not get to look at sunshine, but to see the sunshine on the camera. It's amazing. Perfect choice.
Stephanie, listen, first of all, this hot pink is doing the same, okay? So definitely an opportunity there. And I do see someone asked a question.
Fantastic. Let's take a peek.
So
do you want to go ahead?
You know, go.
Oh, how do you explain the struggle many of us have with imposter syndrome? Great question, especially as it relates to mental wellness.
Listen, in 60 seconds, I'm going to give this answer. And it really is about thinking about what opportunities we have to focus on, our skills, our resources, our opportunities to think about who we are. It's not about what we do. And I think sometimes imposter syndrome comes because we're comparing, and comparison is the thief of joy. I will also say that there's opportunities to think about what you give and reframe it about who you give to, what you give, how you connect to others. And there's always something that's uniquely you that can be focused on.
Great answer. Well, we're down to just less than a minute here. I want to acknowledge Olivia, who is living for our blazers here. So thank you so much for that. And James Campbell is back. So I want to thank everybody for attending, and I would love to turn things over to James.
Excellent, Stephanie, and thank you, of course, to you and especially Tremaine for a wonderful webinar. We're so grateful. And as Tremaine mentioned, there are many places you can go for additional information, including our own website. NAA maintains an online portal for especially relevant offerings for NAA members, and the URL is featured at the bottom of this particular screen. In addition, both Tremaine and Stephanie mentioned our National Mental Health Action Day. And what we're encouraging all NAA members to do is to invest 1 hour in yourself and your colleagues, as Kendra and her company had done. Ideas include hosting a mental health event for employee self-care, giving employees time off to practice their own mental wellness, and developing and promoting your organization's mental health policies. Share your actions with the hashtag NAA Mental Health Week, and there's also a URL featured below where you can download a toolkit for more ideas and information. Now, speaking of mental health policies, NAA business partner organization Grace Hill has provided us with a sample mental health policy to share with all NAA members. It can be customized to align with your organization's policies and procedures, and you can download the sample through the URL featured below. If you found this particular webinar valuable, you can visit NAA's website and YouTube channel for a host of mental health webinars viewable on demand. These include last year's highly attended Mental Health Awareness Week webinars. Simply go to the URL featured below. Another valuable mental health resource of which we're especially proud is NAA's Mental and Emotional Health Survey. This groundbreaking study is just finishing up its 3rd year of providing actionable insights for our whole industry. Results will be presented at this year's Departmentalized 2023 conference and posted to NAA's website. You can view these results at the URL featured below. Finally, we are especially pleased to announce that NAA has sponsored 12 NAA members to become certified as mental health first aid instructors. Mental health first aid, as Tremaine had mentioned, is widely viewed across North America as the premier mental health awareness training for individuals and corporations eager to provide layperson support to those in emotional distress. This one-day course teaches you how to identify, understand, and respond to signs of mental illness and substance use disorders. To reach out to one of these 12 certified instructors, simply click on the URL below. And again, I wish to thank everybody for participating today and all this week, in fact. A special thanks to today's presenters, Tremaine and Stephanie, and thank you as well to our audience. We value your membership and appreciate your attendance. Have a great afternoon.